Hi, welcome to Straight Talk. You know, it's back to school already. Can't believe it, summer's over, fall's here, and that means school time for our kids. So today on Straight Talk, we're gonna talk about how to keep our kids safe and healthy and well prepared to go back to school. So we're really gonna get to the first thing first, which is our physical health, vaccines, screenings. What do we need? And joining me is Dr. Kathy Cornelius with Chase Brexton, which we all know and have loved in the city for a long, long time. And you work at the Randallstown office.
Yes, I do. Shout out to Randallstown.
Yeah, we love Randallstown. It's my hometown. Anyway, thanks for being here. Let's kind of get let's talk about some of the basics. You know, if you're a parent and you have a young child and you're ready to go back to school, what should they start thinking about?
Well, aside from the fact that how am I going to get my kids who's hopped up on sugar start going back to sleep on time, what do I need to start getting them ready for the new school year? What is it that the tools that they need to start the year off right? And the best thing to start is giving them a physical. A lot of people feel that, you know, once their kid reaches a certain age that they don't need to come in to get physicals anymore because they got all of their vaccines. Usually by the age of 4, you know, we really stop giving them vaccines, but there are some crucial ones that they receive during the ages of 11 to 12 and also when their ages 13 to 14. Coming to get a physical is also important because it's that time where the doctor can interact with your child and evaluate if there are any social concerns, if there are any developmental concerns or emotional concerns, and identify them and possibly treat them before they get worse. For a lot of kids who are already in sports or who plan to try out for sports, it's very important to get a physical. And doing that at least 6 weeks before tryouts is important because any concerns that the doctor may have noticed, they can address it in a sufficient time so it doesn't delay them starting.
Yeah, you know, it's such a good point because when you think about getting those physicals, like in athletics, in let's say high school, you have to. But other than that, you don't. And so, you know, your point's very well taken that, hey, you should do it anyway for every year just to see what's going on. Now, what about vaccines? Where are we on the vaccine scale of age and what should they be getting for the younger children?
So I think vaccines have done a really good job, so much so that they've kind of made themselves seem like they're obsolete. They've helped prevent more than 90% of them some diseases. And because of that, people are like, why do we need vaccines anymore? But those bacteria are still out there. And if we give them opportunity, they can recur. And you see that with some of the outbreaks that we're seeing of measles and whooping cough. So usually your child is born, you have vaccines at 2 months, 4 months, 6 months, so a flu vaccine at 9 months, then they have their 12-month-old vaccines. Then the next time is usually 15 months, 18 months, and then 4 years. And that's when our parents tend to disappear. Like we don't have to see the doctor anymore. However, your child is still growing. There's a transition from childhood to teenage years, so there's puberty. During that time, there are a couple of vaccines that we start administering that are important, such as the HPV vaccine. There are boosters, such as tetanus. And there's also Menactra, which is important, especially for those who plan to go off to college, because if they're going to be staying in the dorms, meningitis is a horrific disease.
Yeah, we hear a lot about that, a lot about it. Now, you guys are doing a kind of a back to school with Chase Brexton.
Yes, we are.
Tell us about that, too.
So the back to school program is targeted for all children that need to get a well child physical. And for coming in and doing what they're supposed to do, they get a backpack filled with goodies. So it's a win-win situation there.
Yeah, but you're trying to get parents in.
Yes.
I mean, that's, you know, you're really trying to get them to kind of get off the dime, so to speak, and like take care of their kids after 4.
Yes, we are, because they disappear. And
because it's not required.
Because it's not required, because they've gotten most of the shots that allow them to get into school. But your child is still growing. Many times your doctor may address a concern such as if there's concern for possibly anemia, diabetes. We have a childhood obesity as an epidemic, checking for things like cholesterol. Sometimes your child may have some emotional needs and screening for things like ADHD, vision exams, hearing exams. These things are overlooked by failing to bring your child in every year because you're like, they look fine. They're okay. Now, I grew up where, you know, it's like, oh, you only go to the doctor unless you're like dying or bleeding. But in this day and age, especially with some of the government acts that we have that have provided health care to a lot of our younger children, they're able to come in and get the benefits of seeing a doctor.
It's hard to teach prevention.
Yeah, and there's no excuse.
We're very crisis-oriented,
yes,
but not
we
very
are.
preventative.
And we've made it even for those who are uninsured at Chase Brexton. We are the safety net. So basically, individuals of all incomes are welcome. And so if you don't have insurance, we have fee scales that can allow you to bring your child in and get seen.
Yeah. Talk to me a little bit about the need for good nutrition, sleep for young kids. How important is that?
Well, I think everyone realizes it's very important. I'm really glad you brought that up. In America, our children aren't getting enough sleep. They really are not. We think it's okay that they're getting 7 and 8, and it gets worse as they get older as teenagers, because sometimes they're cramming for a test, and we as parents, sometimes we encourage them. However, usually kids under the age of 12, they should be getting at least 11 hours of sleep, 10 to 12 hours of sleep, and then in teenage years, 8 to 10 hours of sleep. So it's really important because studies have shown that when kids do not get adequate sleep, their school performance suffers. It ends up leading to them feeling fatigue. It ends up to actually causing some emotional outbursts, things like depression, also lack of concentration. And individuals may think, oh, my child needs to be on meds. No, your child just needs to get some proper sleep. Food. Well, we all know we need food to eat, and a lot of us, we live to eat, but we need to eat to live. And by that, we need to start putting a nutritionally dense, important food into our children, eating a variety of food. So I always tell parents, go colorful, experiment, lots of green, lots of red, lots of blue, lots of yellow. Just expose your child to everything out there. If your child's smarter than the average bear, you can sneak it. You can put it in things like smoothies. Sometimes you can make purees, but it's very important to get nutrition. And I know it's hard, and when I was thinking about meal times in the average American family, it's very hard because sometimes you have a single parent, or you have both parents working out of the home and working outside, and so it's like, what do we do? Meal prep is something that can really help.
And it's very, very important.
Yeah,
very important. Now, we have to go to a break, but I want to first thank you so much for what you're doing at Chase Brexton, and also reiterate to everyone, we've been putting the website for the back to school.
Yes.
So thank you so much. Great information. We could talk all day about this. You're terrific.
It was my
Appreciate
privilege
you
being here. Thank you.
When we come back to Straight Talk, we're going to talk about traffic safety for our kids. Very important. Stay with us. We're coming right back to Straight Talk.
Oh my goodness.
I just need a second.
Is your weight holding you back? Are everyday tasks getting harder and harder to do?
Did you see this? Your cousin's in the hospital from a heart attack.
Really?
Health risks associated with excess weight or obesity can be serious.
Training's
But
there.
you can do
Because
something
you guys
about
used to
it.
get all the Ryan White money
I know you're worried.
years ago.
I found this.
Take the Your Weight Matters Challenge. Visit yourweightmatters.org, where you'll find free resources to help you take control. You can start improving your life right away. Download the free toolkit to prepare you to speak with a healthcare provider about your weight and health. Your weight does matter. Accept the challenge and take charge today. Visit yourweightmatters.org.
I had big plans. I had my career path all planned out while I was on a combat patrol in Baqaba, Iraq. A rocket-propelled grenade took my arm off at the shoulder. When I came home, I felt alone. My family was around me, but I couldn't talk to them about what I'd seen and what I'd done. I remember just thinking, man, the way I am right now, I don't want to live. I was discharged from the Army, and I've been working with the Wounded Warrior Project since 2007. Warriors don't have to be severely wounded to be with the Wounded Warrior Project. We do have a lot of guys that have post-traumatic stress disorder. Being able to share your story, I guess it kind of helps you wrap your mind around what did happen over there. Just because you left the military doesn't mean your life is over. Because when these guys are coming home, I'm kind of leading and training them. Instead of for combat, I'm leading and training them to heal. If I come away with anything from Wounded Warrior Project, it's them giving my life back. My name is Norby, and yes, I do suffer from post-traumatic stress disorder, but I'm okay.
Hi, welcome back to Straight Talk. We're talking about kids going back to school, being safe, taking care of themselves from head to toe. And one of the areas we're all concerned because our schools are now closer to us. Our kids are going to be walking to school. Some kids, as they get older, will be driving to school. And it's another whole set of issues. So we've invited Myra Weeman from AAA. You see her on TV all the time telling us about the gas prices and everything good going on the highways. They do an amazing job. And she's here to help us kind of go through back to school. And you've got my favorite thing in the world is the safety program.
I do. I brought this especially for you, Mike.
We all grew up with that, and you forget about it because we have the crossing guards.
Right.
But safety, to be on the safety patrol. So Howard, thank you for being with us.
You're welcome. Good to see you again.
Let's talk about back to school because it is all the different ages. Tell us, you guys are doing a lot of stuff.
We do a lot. Our AAA Mid-Atlantic opened a foundation about 15 years ago. And that foundation is dedicated to providing traffic safety education for all age groups. And many of the programs that we offer are geared towards school-age children. In fact, this one right here, many are geared towards the elementary age children. So this one is our oldest. The Safety Patrol program, believe it or not, began in 1920 out in Chicago. And it's really a peer leadership program. You know, back in the 40s and the 50s, the kids that wore these belts and badges, they could easily be a mile from school grounds, but they would stand at their corner and make sure that kids could get across the street safely. Now the program's evolved a little bit. Most of the kids are very close to the school. Some of them are still helping them get across the street by checking for traffic first. And we also have some at the school bus stops. We have them in the school bus loops, parent pickup and drop off, which is a huge area nowadays. And we have some inside the building too. But really it comes down to not only traffic safety education, but a peer leadership education program.
Yeah, it was a special thing. I mean, we all grew up with safeties.
That's right.
And they were like, it was special.
It was.
It
still is.
They got educated. They knew. You gave them respect.
Right.
It is. It was probably one of the first peer leadership programs we've ever had.
That's right. And through our foundation, we're able to supply a lot of all of the training. Really, we also supply all of the materials free of charge through AAA Mid-Atlantic, along with some other supplemental materials. And we also have some award programs for these kids that really go above and beyond.
That's really fantastic. Now, crossing guards, who do they work for? Do they work for the schools or the police? Or
Most of them work for the police here
For
in
the
the Baltimore
police,
metropolitan
okay,
area. Yes,
okay.
they work for the police. In some of our jurisdictions, such as Montgomery County, Maryland, the school safety patrols work with the crossing guards. So the crossing guard is the one in the street, obviously. The safety patrols are on either side of the sidewalk, just kind of helping the kids know when to stop and when to go.
a little bit of a training,
That's right.
Now, keep going. I know you got more stuff going on in these schools.
Well, another one of my favorite programs is our talking car named Otto, 3 foot high, 3 foot wide, remote controlled. And this talking car goes into schools, mostly to schools ages 4, 5 to about 7. So about pre-K up to about 2nd grade. And the car will teach these kids all about traffic safety. We put them on the floor so they're eye level to the car. And we work with groups of about 50 or less, so a lot of them get to interact with this Otto. And he'll talk to them about crossing streets safely. He'll talk to them about why you need to stay in your car seat or your booster seat, and it's not just for
I'm
babies.
showing Otto right now.
And he'll even put a helmet on and ask kids what's wrong with it, of why it doesn't fit his square head.
And you're talking bike safety too.
We do a lot. Pedestrian,
That's
bicycle.
what I mean. I mean, we talk about kids, bike safety is really a big deal.
Right, and our bike safety program that we started about a year ago was a partnership with Baltimore County, working with Officer Spriggs. We created a program that is really specialized depending on the grade level. So we start with PowerPoint based, but it's not your usual PowerPoint for kids. It's graphics and photos, some funny but educational little video clips, and then we go out ahead of time and take pictures of all the different crossings around that particular school, and we embed those photos into that PowerPoint. And the reaction of the kids when they see their school on that big screen and we start talking about, is this a safe place to cross? We really seem to resonate well. Our friends at State Highway have a portable working crossing signal. a pedestrian crossing signal. We roll that in as
Oh my
well,
God,
and
that's
we
great.
we talk to them about the different features of those signals. You know, some of them talk now, some of them have a countdown, and we explain to them what all these features are. And then we have a 10-foot rubber mat that looks just like a crosswalk, and we bring that in as well. So everything is interactive. We get them up, we get them moving, instead of just talking at them.
You know, it's so important. It's one of these things where you assume someone's going to teach you.
Right,
And parents probably don't even get a second thought.
right.
You know, maybe they're walking their kid downtown and they're saying, hey, don't walk.
Yeah.
But this is so good. This is so cool.
Thanks.
You know, for these kids. And it's young. And it is at a preventative time when you can still
Right.
reach them.
Right.
But
Those programs are all for the younger market, and then we
Yeah,
also have some programs, you know, for the older
Well, I
drivers
know
and
you.
the
I
adults.
know
and
you guys are so
teens.
big on drinking and driving and distracted driving.
Still
I mean,
are.
you guys have always been out front with that.
And we're
that's
also
the older kids.
Right, and very involved in actually drugged driving now.
Yeah.
We've had some drugged driving symposiums. We had a big one here in Maryland, and we continue to really lead the charge in that as well.
Well, you guys are doing it all. I mean, I just, I had a fortune of working with you for many years, and it's
Yes.
just a great organization. So
Thank you.
thank you so much for everything that you guys do, from those young ones to the older ones. And we appreciate it. Thanks for being with us.
You're welcome.
When we come back to Straight Talk, we're going to talk about how do we make sure that all of our kids have the right food that they need to have a good school year. So stay with us. We're coming right back to Straight Talk.
Who helps a hero? Who tells the story of their scars? The freedom and safety of so many, of us all, is earned by the sacrifices of so few. Who helps a hero? We all do. The Gary Sinise Foundation works to support America's defenders and strengthen their families through entertainment, the construction of smart homes for our wounded heroes, and by inspiring and educating others to also support the veterans within their own communities. We enjoy the benefits of their sacrifice and service each day. Now it's time we serve them. Find out how you can help our heroes at GarySiniseFoundation.org. While we can never do enough to show our gratitude to our nation's defenders, we can always do a little more.
Calls me googly eyes.
You know you're beautiful, right? You know that?
Even you're beautiful. I got bullied for wearing glasses. Share if you're against bullying.
We put it out there, just took off. 3 million people have shared this post. Don't let bullies get you down. I stand with you. Our whole family's wearing glasses. I wear glasses and I'm proud.
I even have the army on my team.
All the kind comments brought my child joy. I don't feel thank you is enough.
That's
Hi, welcome back to Straight Talk. We're talking about making sure that our kids are prepared to go back to school. We talked about health. We talked about safety. Now I want to talk about for those kids who may not have the resources to have enough food to eat. It's hard to believe, but it's true. And two of my favorite people are here. They come in every year and tell us about the amazing stuff they're doing, feeding kids who are homeless and they just don't have it. It's Kristen Wilson and Pamela Wilson.
Yes.
With Heart's Place Services.
Yes.
Favorite. Terrific.
Thank you.
Who wants to go first?
Well, he can.
I'll go first.
Give us first. I know all about it. I love it. But let's let everyone know what you guys are doing.
Okay, we started approximately 7 years ago. We knew that there was an issue of poverty within the city of Baltimore. So what we thought we would do is to find out through a local school how we could possibly assist people who required our help. So we visited one of the local schools, sat down with the principal, and she told us the usual things that they need, pens and paper. But then she says, there's one thing that you have to remember, that I, as an educator, cannot teach hungry children. So we went back, we had a meeting, and we created this, a 12-pound, 2-ounce backpack of food sufficient to feed a family of 3 for 2 days.
Wow.
When they don't have food on the weekends, whereas during the school day, they have breakfasts and lunches. But on the weekends, there's very little, or they live in food deserts and can't find good food, so if they even have the funding for it.
Right. So this program, we decided with one school, and we wanted to test it to see how it was received. And every single child was ecstatic, but just as happy as could be, because now over the weekend, he was guaranteed breakfast, lunch, and dinner.
Now, where did they pick up their pack? At the school?
At the school.
Right at the school?
Right at the school. We deliver the backpacks in the past directly to the school, and on Friday, just before they leave school, they walk into an office and they pick up this pack. And I'm telling you, it is heavy.
I was just going to say, you should set it down. You've been holding it a long time.
And
set it down. That is heavy.
Yes. And we have children as young as 7 years old taking them out to their transportation and going home with it.
Amazing. Pam, you never think about the weekend like that.
Exactly.
I mean, you think, oh, kids all go home. And at home, everything's fine, everything's okay. Even if they get lunches and breakfast at the school, you don't think about the weekends.
Absolutely. We didn't know. I mean, that was one of my things. We didn't know, and everybody we spoke to said we never knew. And in doing research, this is something that people are really looking into. Back in March, the University of Baltimore Law School has a program for children and families, and it has to do with truancy. And they found, they were talking about how trauma actually affects the developing brain in 4 places in children. And this is children from grammar school all the way up through high school. And it manifests itself in cognitive, emotional, and social behavior. And this is where kids are acting out in school, they can't learn, and it really affects their future. And in fact, Janet Yellen from the Federal Reserve spoke a few months ago about a study they did as well, and I thought that was kind of amazing. But they found that people who grew up as children having trauma of stress, of not having enough food to eat, of not knowing where they're going to be living, had problems with finances, with keeping jobs, all the things that we feel are social ills, and it stems from childhood and hunger. Yes, you can even live on a street, but you can't live without food. So
you're now, how many of these are you giving out?
We're giving out 300, well, we're feeding 330 people. So each one backpack feeds a family of 3. So we're giving out 100 backpacks through 7 schools within the city of Baltimore.
Every weekend?
Every weekend.
During the school year.
Okay, now the big question is, how do you get the money to do this?
Well,
obviously you need some help out there, right?
Yes, we do.
We want people to help donate and give out some money here.
Right,
Absolutely.
well, you have to totally understand one thing. In the city of Baltimore, there are currently 2,700 children that are registered as being homeless in Baltimore City public schools. That figure may go up 100 or down 100 each year. It fluctuates nominally. But then on top of that figure, the ABLE Foundation did a study in November of 2016, and they found unattended youth from 12 years old, starting at 12 years old, who have either been kicked out of their homes for a multitude of reasons. They're also walking the streets of our city without food. So our program...
We've got your number up on the screen.
Okay. Right.
How they can send you some money, contributions, help, food, anything.
Well, right.
You know,
it's
to
$20.
help pack up those bags up and get them to the school. You know, it's just amazing. You know, it's an amazing program of what you're doing. And like you said, if we've got thousands.
Yes. Yes,
you know,
we're just scratching the surface.
You know, we're just scratching the surface.
Yes.
And we did a end of school year survey, and when it came back from teachers and principals, 100% of the students that we serve had improved attendance and fewer medical and illness complaints. 99% of the students had improved grades, less detention, less acting up, improved self-esteem, greatest feelings of security, trust, better relationships with the school staff and other students. And these educators said that they saw an increase of joy in these children. And
well, we had a doctor on the first segment.
Yes.
She talked about how important it is to be fed.
Right.
Yes.
You know, to learn and be alert and have energy. Right. And all the things that we need, and I think we
and this is filling a need.
Yeah,
this
we
is
just assume they're going to be fed.
Absolutely. And one backpack costs $20, and it's for 1 week for the family, or $660 for the year for one family. It's not a lot of money, and every little bit helps. And we're all volunteers in our organization. Nobody gets paid anything. So.
So any money that is raised goes directly into the program.
You guys have been doing this for how long?
7 years.
7 years.
Yeah. We also have a
lot of backpacks.
Yes. Yeah, we also have a annual coat drive, and in 11 years we've given out 8,300 coats.
Hearts Place Services. And we put the number up again. Your organization, please, everyone, give them some resources, help them out, you know, grants, anything we can get you, you know. But I want to thank you so much for what you do. It's just
thank you
it's
so
just
much.
amazing.
Thank you so much.
It's just
It's
a
our
wonderful,
pleasure to do
wonderful
it.
thing to take care of these kids. Thanks.
Thank
Thanks
you.
for being here. Today on Straight Talk, we talked about getting our kids ready for back to school, from medical conditions to food to being aware. We want our kids to succeed, but they have to be healthy. And it's our job to make sure they are. I want to thank all my guests and thank you for watching Straight Talk, and we will see you next time.
Traffic jams don't actually start downtown or in the tunnel. They start in the counties and neighborhood streets. We understand that helping you find which turn can make all the difference. Fox 45 Morning News.
On the next Wendy, let's have a Kiki. Friend to the show, Kiki Palmer, returns.